Hi and welcome back in a new episode of SHAKET DABOUS. Our subject today is about the arthroscopy. But now, what do you know about the arthroscopy? How old is this procedure? When was the first arthroscopy done? And which joint is the first joint we could see it from inside? So, to know shortly about the history of the arthroscopy, I would like to show you this video. Let's see it. Over the centuries, humans have shown always a desire to look into the body cavities. Closed cavities pose a specific problem with the necessity to introduce light into the cavity in order to see it. In 1906, Pozzini designed an instrument named Lichtleiter to see the bladder. 50 years later, Dr. de Sommer developed gasogen cystoscope, and after the developments of the light cup by Thomas Edison in 1879, the first cystoscope with candlestick bulb developed by Leiter and Nitz in Germany. In 1918, Professor Kenji Takagi in Tokyo, the first applied endoscopic principle of cystoscopy to examine the knee joint. And in 1921, Dr. Perschner performed gas arthroscopy using carbon dioxide or oxygen to distend the knee. In 1931, Baumann described an experimental cadaver study of arthroscopy with the visualizations of the hip, knee, shoulder, elbow, and wrist joint. Professor Watanabe Masaki, it is a Japanese surgeon who used the first modern arthroscopy for the knee. The first case of true surgery under arthroscopic control was performed in the 9th of March 1955, and it was a resection of oval tumor in the medial part of suprapatellar recessus. The first partial meniscectomy done in the 4th of May 1962. 1970, Dr. Hiroshi Ikoshi was the first surgeon did removal of discoid lateral meniscus. Dr. Johnson Joyce and Michel Harty organized the first course of arthroscopy in the United States in 1973 in the University of Pennsylvania in Philadelphia. Dr. O'Connor was successfully improving the standard arthroscopy and designing and operating arthroscopic instruments with cooperation of Richard Wolf Medical Instrument Incorporation. The first book on arthroscopy published in North America as Arthroscopy of Knee in 1976. 1977, Lonnie Johnson of East Lansing, Michigan, was developed a motorized intra-articular shaver together with Dynamics Incorporation. The first courses on operative arthroscopy organized by Dr. O'Connor, 1979, sponsored by University of California. It was not until 1980s shoulder arthroscopy was developed as a diagnostic tool to identify previous undiagnosed conditions like slab lesion. The first interventional procedure was arthroscopic subacromial decompression. Since 1990s, with the great technological advances and developments of specific instruments to treat rotator cuff tear, AC joint arthritis, impingements of the shoulder, and labrum tear. Hi and welcome back. Yes, labrum tear. This is what I want to show you today. Shoulder arthroscopy. I did it for a young patient. He had pain in the shoulder after playing basketball with a clicking and limitation of movement. Clinically, I was suspect of labrum and rotator cuff injuries. And as we will see now, I sent the patient for MRI, and the report was diagnostic rotator cuff tendinopathy, extra-articular tendinopathy, and labrum tear, as we see, and the inferior part of the glenoid. Also a part of impingement and tendinopathy of the rotator cuff. So, as we see the video, prepare the table for the shoulder arthroscopy, and then starting the nerve block as a pain management under the ultrasound guidance to relieve the patient post-operative. And then we started to infect the shoulder and the arm, and then covering the operated shoulder. So I started to make markers for the portals of the shoulder joint, and then insert the arthroscope. Here found the suprascapularis muscles is intact. There is a different degenerative changes in the labrum, and there is a tear. Here we see there is also synovitis, and the biceps tendon seems intact. So here we go again to the glenoid. It is good, and that is the definitive tear of the labrum. In the inferior part, we saw the teres minor is intact, and this is the bed of the supraspinatus tendon, which is often intact. Now we start to do shaving the site of the tear, and make some partial synovectomy through the electrocauter, and also make removal of the degenerative changes. Now we start to put the hole for the anchor through the puncture in the site of the tear of the labrum, and after the specific entrance, we pass the guidance wire through the labrum or the torn labrum and pull the suture. So now we insert the knotless bio anchor inside the glenoid, which pull automatically the torn labrum, as we see, to it. Now we make just test, and then we make also cleaning of the operated part or the site of the labrum. So as we see, shoulder arthroscopy, minimal invasive procedure. We can do a lot of repair of injuries, or deal with any pathology in the shoulder joint. Our patient is now under rehabilitation for the shoulder after labrum repair, and promising to return back to the basketball professional player or a professional playing in within 4 to 6 months. I hope you liked my video. I hope also I give some information about the history of the arthroscopy, and also the benefits of the shoulder arthroscopy, and see you in the next episode of SHAKET DABOUS.